𝘐𝘍𝘗 Free Press, Tuesday, October 27, 2020. IFP Editorial, Tuesday, October 27, 2020. Home isolation in the Leikais. The introduction of home isolation SOP for COVID-19 positive who are asymptomatic or these having mild symptoms has certainly created a flutter among the general population in the Leikais, even sometimes creating hostility towards the family who are permitting COVID positive family members to stay in the home isolation. The local clubs could be made to understand the difficulties of housing all positive persons in COVID care centers opened by the authorities, but it is very difficult to convince many of the individual level. It is said that the idea of home isolation was developed in view of large number of asymptomatic cases being detected, and that government has extended the current guidelines with regard to asymptomatic positive case also. Besides very mild and pre-symptomatic cases, however, the lack of adequate facilities or required manpower to man the COVID care center seems to be the main consideration for advising home isolation by health authorities. According to the guidelines, who is eligible for home isolation, the person should be clinically assigned as a very mild or pre-symptomatic or asymptomatic case by the treating medical officer. Such cases should be the requisite facilities at their residence for self-isolation and also for quarantining the family context. Patients suffering from immune compromised status, HIV transplant recipients and cancer therapy, etc. are not eligible for home isolation. Elderly patients aged more than 60 years and those with comorbid conditions such as hypertension, diabetes, heart disease, chronic lungs, liver, kidney disease, cerebrovascular disease, etc. shall only be allowed home isolation after proper evaluation by the treating medical officer. A caregiver should be available to provide care on 24/7 basis. The guidelines add that a communication link between the caregiver and hospital is a prerequisite for the entire duration of home isolation. Altogether, out of the cumulative number of 17,424 positive cases in the state, 1,491 persons were advised home isolation, of which 550 are still active cases. As many as 13,057 persons have recovered, while 4,223 are still active, besides 144 deaths. On the other hand, the daily surge of positive case ranges from 150 to 300 plus against the average number of 2000 tests daily. Considering the number of tests done daily, the positive rate is quite high. That is exactly why we had earlier talked about starting zero surveillance in the state. But the more important question now is how many families have the facilities as laid down in the guideline for home isolation in the state, except for some upper rich and rich families in the urban areas. Separate toilets facilities for each member of the family is very equivalent. Suppose so poor and middle class families is common toilet is a feature in many homes. So the very idea of home isolation is urban centric and also catered to the rich who can afford separate toilets, and the idea of home isolation is defeated here. This has been the main concern of general public in authorities advising home isolation to COVID positive persons in the Leikais. Hence the hostility from many individuals. Some may try to explain it away as lack of awareness among the public with regard to knowledge of COVID-19, but no one can dare claim to have full understanding of how COVID-19 moves around the society and the general population till now. Thank you.